I'm Wade Garrett. I'll be testing wrist and hand kinesthesia and dermatomal distribution of L4 for discriminative pain, sharp and dull. First, I'm going to do the wrist and hand kinesthesia. I will test the uninvolved side first. Explain to the patient which motion is which. I will explain this is flexion, this is extension. Have them close their eyes please, and have them tell me if this is flexion or extension.
Extension.
Is this flexion or extension?
Flexion.
Is this flexion or extension?
Flexion.
Flexion or extension?
Extension.
Good. Then I will check the involved side. Involved side. I'll have them close their eyes. Tell me, is this flexion or extension?
Flexion.
Flexion or extension?
Flexion.
Flexion or extension?
Extension.
Good. The kinesthesia of the wrist and hand has a stimulation of receptors of the first order neuron. They are conveyed in the dorsal root ganglia, then ascend ipsilateral to up the dorsal column, and since it's the upper extremity, the axons are called the fasciculus cunatus. Second order neuron, and then the axons of the fasciculus cunatus then synapse with the nucleus cunatus in the medulla, then crosses midline to the thalamus as the medial lemniscus. Second order neurons then synapse to the VPL, and on that cell body of that third neuron then travel to the primary somatosensory cortex in the superior lateral section of the cortex due to it being upper extremity. Next, I will test the distribution of the L4 of discriminative pain, sharp and dull. I have a sharp object out of the reflex hammer, and I have a dull end of the reflex hammer. The L4 dermatome is medial calf, and so I'll test from medial to the tibia, and I'll test from medial malleolus up, and have the patient describe if it's sharp or if it's dull. And I'll have the patient close their eyes, and I'll ask if this is sharp or dull.
Sharp.
Is this sharp or dull?
Dull.
Sharp or dull?
Dull.
Sharp or dull?
Sharp.
Good. I'll test the more involved side. Have the patient close their eyes. Is this sharp or dull?
Sharp.
Sharp or dull?
Sharp.
Sharp or dull?
Dull.
Sharp or dull?
Dull.
Sharp or dull?
Sharp.
Good. So the dermatomal distribution of L4 for discriminative pain, receptors of the periphery of the free nerve endings through the cell body of the dorsal root ganglia, synapse ipsilaterally in the dorsal horn. And since then decussates immediately at the level of the spinal cord, which is the L4, the axon then travels very laterally in the anterior lateral system through the cord, up through the brainstem, into the thalamus. Then synapses in the VPL, and the cell body of the third order is located in the VPL, and it travels to the primary somatosensory cortex. Thank you very much.